What's up, YouTube? It's your boy Maverick Raven coming at you with another video. And the studies don't look good, people. The vaccine studies do not look good. Let's get into it, huh? The Epic Times says COVID-19 vaccine protection among children plummets within months, the CDC study shows. Agency says results show why it recommends kids get an updated shot. Yeah. Yeah. Look, I'm not a medical professional, okay? I'm just doing what I feel is best for my family. Um the vaccine is something that our family has chosen to not do at all in any way. We're all purebloods over here. But if if you got to get it for your job or what have you, that's on you, I understand that everybody's situation is different. But again, I'm not giving any medical advice. I'm just giving you my side of the story, okay? But before we get into the story, please don't forget to like, share, subscribe, and comment on the video. All that stuff is really, really important, especially the subscriptions. If you could sub, I'd really, really appreciate it. But anyways, let's get into it. From the Epic Times, it says children who received an original COVID-19 vaccine have little protection against hospitalization just months after vaccination, according to a new study from U.S. Centers for Disease Control and Prevention, the CDC. Children initially have 52% protection against hospitalization, but that estimated effectiveness plummeted to 19% after 4 months, according to the paper. Protection against so-called critical illness dropped sharply from 57% to 25%, researchers found. The researchers include CDC employees, and the paper was published in the CDC's Weekly Digest on April 18th. The study covered children who received 2 or more doses of the original Pfizer, BioNTech, or Moderna COVID-19 vaccines from December 19th, 2021 through October 29th, 2023. The study involved children aged 5 to 18 who were hospitalized with acute COVID-19 and tested positive for the illness, and compared them to a control group of children hospitalized with COVID-19 like symptoms but who tested negative for COVID-19. Researchers drew data from the Overcoming the COVID-19 network, which includes healthcare sites in most of the United States, and ended up with 1,551 case patients and 1,797 in the control group. The study found that receipt of greater than original, monovalent COVID-19 vaccine doses was associated with fewer COVID-19 related hospitalizations in children and adolescents aged 5 to 18 years. However, protection from original vaccines was not sustained over time. Laura Zambrano, a CDC epidemiologist, and her co-authors wrote. It also recorded a similar drop in protection against critical illness, defined as being placed on mechanical ventilation, vasoactive infusions, extracorporeal membrane oxygenation, or dying. Wow, some pretty serious stuff there. The researchers asserted that the results highlight the current CDC guidance that all people aged 6 months and older receive one of the newest COVID-19 vaccines, which were introduced in the fall of 2023 with clinical data from just 50 humans and no efficacy estimates. Guys, 50 people and no efficacy estimates. Now, the efficacy estimates, from context, it seems to be, what they expect and how effective it is at preventing or mitigating COVID-19. But the fact that it's on 50 humans, that's nothing, dude. That's like there's parties bigger than that. A lot of parties bigger than that. You know what I'm saying? Like, that's nothing. The CDC only publishes papers in its weekly digest, the Morbidity and Mortality Weekly Report, after they're shaped to comport with CDC policy. The papers are not peer reviewed. Ms. Zambrano did not respond when asked for data suggesting that the currently available shots provide longer lasting protection than the original vaccines. the CDC's website says in promoting vaccination that COVID-19 vaccines are effective at protecting people from getting seriously ill, being hospitalized, and dying. But the hyperlink that ostensibly supports that statement goes to a page that is not live. Real professional there, CDC, but what more could you expect from a government agency, you know? U.S. authorities have been moving COVID-19 vaccines to a once-a-year model similar to influenza vaccines. The model features updating the formulation of the vaccines on an annual basis in an acknowledgement that any protection the vaccine gives quickly wanes. The formulation is typically updated in the fall. Just 14% of children and 23% of adults have received one of the newest vaccines as of April 6, according to CDC estimates. The available vaccines are messenger RNA, shots from Pfizer and Moderna, and an alternative from Novavax. Dr. Jane Orient, executive director of the Association of American Physicians and Surgeons, noted that according to the new paper, the maximum effectiveness estimates against hospitalization were 61%, regardless of how the data were sliced, and that more deaths were recorded among the case patients, and the median hospitalization duration was 4 days for both groups. I do not see how a clinician whose concern is treating patients and whose job does not depend on pushing mRNA vaccines would find this a basis for recommending shots. Quite the contrary, Dr. Orient, who was not involved in research, told the Epoch Times in an email. It reeks of conflict of interest. Yeah. Again, not medical advice, just my opinion. Stated limitations of the paper include not assessing post-infection immunity and a lack of sequencing data. The conflict of interest section runs 688 words and includes some of the authors reporting funding from Pfizer and Moderna or ownership of Pfizer stock. I mean, unless you have like a crazy amount of Pfizer stock, I wouldn't care. Like probably one of the things that I have, one of the group stocks that I have probably has a little bit of Pfizer in it, but that doesn't mean that I own Pfizer stock. Now, if you've got like, hundreds of shares of Pfizer stock and each one is worth, however much, then yeah, definitely conflict of interest. But like Dr. Jane Orient said, man, this is something to look at and seriously consider. But anyways, that's the video, you guys. Yeah, man. Really, truly, stay safe and stay based.